There's certainly been a lot of discussion around meaningful use and requirements, so we hope our discussion today will be helpful as you plan your attestation activities this year. In fact, now that the move to ICD-10 has been delayed another year, there's certainly more time to focus on meaningful use, especially if you're moving to stage 2. For our session today, we'll be looking at meaningful use for eligible providers, as the Preventative Care Reminders measure only applies to EPs. However, patient engagement strategies benefit both hospitals and eligible providers. So today we're going to look at some of the myths and realities of meaningful use and preventative care reminders and the challenges that these myths and realities pose for 2014. And we'll talk about how to create successful patient engagement strategies using automation to improve your clinical quality metrics. And then lastly, how can we design patient engagement activities to motivate your patients to participate in their own care? We know this is a key theme for stage 2 and other initiatives like ACOs. So let's start by listing some of the common myths around meaningful use and preventative care reminders that I have been hearing on a regular basis and working with eligible providers, and that we'll be touching on throughout this discussion today. So some of these common myths that we hear about are the timelines for meeting stage 2 are delayed. Eligible providers don't need to upgrade to a 2014 certified system. You can use your appointment reminders to meet the preventative care reminder measure. Patient-preferred language is required for communicating preventative care reminders. One of my favorites, that specialists are somehow exempt from preventative care reminders. And we can all use our patient portals to cover all of our patient engagement needs. So let's take a look at the first myth that really started rather innocently. This idea that the start of stage 2 will be delayed. So back in mid-December, the Acting National Coordinator for Healthcare IT issued a statement of intent in an online discussion around EHR adoption levels. So if you read through the original text that exists out on cms.gov, then you would see that there's no proposal to change what's already in flight for 2014 and the start of stage 2. After all, in December, hospitals were already starting their attestations for stage 2 and 2014 back in October of 2013. So eligible hospitals are already following that fiscal year rather than the calendar year that we see with eligible providers. So in spite of this, several media outlets pushed a very different story that led to this confusion about the start of stage 2. And so if we look at that, back in December, right, ONC issued a statement of intent, so that's nothing more than a proposal. So there's nothing binding to that until it goes through the next round, which is the round of rulemaking. There are no changes to the 2014 attestation requirements. Early adopters still get an additional year of stage 1 moving into stage 2 in 2014. But as part of this statement of intent, early adopters would also get an additional year in stage 2 because the proposal was to postpone the start of stage 3, not the start of stage 2. And in addition, there were no changes that were proposed to the Medicare payment adjustments that start next year in 2015. And so the second myth that's associated with that same statement of intent, was that the payment penalties would somehow be delayed. But the truth is that the 2015 payment penalties that are slated for eligible providers and eligible hospitals who don't satisfy meaningful use in 2013 or early 2014 are mandated by law. And essentially that's mandated as part of the ARRA, the American Recovery and Reinvestment Act. So it will require legislation, much like we saw in the recent SGR bill that was passed yesterday delaying ICD-10, in order to change the payment penalties that are coming next year. So there's big impact to this. Since over 250,000 providers have attested for meaningful use in 2011 and 2012, meaning that they had to attest last year in order to avoid that payment penalty, we know that there's a lot riding on being able to attest this year in 2014 as well, because that's almost 50% of eligible providers that have to attest this year for stage 1 or stage 2 in order to avoid the penalties in 2016 based on your attestation this year. There was a fairly significant attrition rate between year 1 and year 2 of the program from 2011 to 2012 at 17%. So 17% of providers who were successful attesting in 2011 for a 90-day period were not successful in 2012 when they had to attest for a full year based on the same criteria. So as we look at 2014 this year and the movement to stage 2, it's hard to know what that attrition rate is going to look like as providers try to navigate the new rules and the new requirements around stage 2. So keeping in mind, of course, that once you start, you can't stop. And lastly, for those providers that have not attested yet, so 2014 is your very, very first year, you must do so you must attest to stage 1 by October 1st of this year in order to avoid penalties in 2015 and 2016. Now, one of the more dangerous myths that I hear often is that eligible providers don't have to upgrade to a 2014 certified system. So one of the reasons why there's only a quarterly attestation period in 2014 is due to the fact that all providers must adopt 2014 certified technology or upgrade to 2014 certified technology before they can attest this year. So EHRs that are certified under 2011 and haven't been certified under 2014 are not valid to use for either stage 1 or stage 2 this year. There's a little bit of a disconnect around that. So the rules around what 2014 systems you can use has changed a little bit since 2011. So in 2011, you had to come up with enough technology to create a complete EHR, whether you used one system, so you used a complete EHR, whether it's a next-gen EHR, an Epic EHR, or any other vendor for that matter. In 2014, you can use either a complete EHR or a complete EHR with additional certified modules that may have better workflows for certain measures, such as e-prescribing or preventative care reminders. Or you can cobble together a bunch of certified modules that provide enough functionality to meet the core functionality required for your core measures, and then each of the modules that you'll be attesting for this year. So you don't actually have to have a fully complete EHR. Most of you will, but just keep in mind that as you go forward, you have a lot more options in 2014 than what we had in 2011. The other thing that's different in 2014 from a certification perspective is that all vendors who certify modules requiring a numerator and a denominator must now certify the reporting for those measures as well. So when we certified Telebox house calls this year for the preventative care reminders and patient lists, we also had to certify the reporting so that you would have the information available then and make it much easier to use modules when attesting for meaningful use. So when you use a module that's certified and requires a numerator and denominator, you're also going to have the attestation data provided in an accurate and supportable form that you can use in the case of an audit. So very important and very different than what we saw in 2011, where you could use a module, but you didn't necessarily have the right information or had to come up with that on your own. And the last general myth around meaningful use that I want to cover is the myth that all providers will attest for stage 2 in 2014. So as we mentioned in the last slide, there are no proposed changes for 2014 and the start of stage 2. However, there's still some confusion about who should attest for stage 2 in 2014. So just as a quick overview on where you sit in terms of which stage you're in, everyone starts in stage 1 regardless of the year that you start. So if this is your very first year to attest for meaningful use, you're going to start in stage 1. And no one, regardless of what year they started, can start stage 2 before this year. So this is the first year that anyone can attest for stage 2. So to determine the stage that you're in, take the first year that you attested for meaningful use and add 2 years. And that is the start of your stage 2. So if you started last year in 2013, I add 2. And so the first year that I am going to attest for stage 2 would be next year in 2015. The other thing that I want to mention then is that if you started your first year in 2011 or 2012, or for that matter 2013, and the next year that you attested you were not successful, that year still counts towards your 2 years. So if I started in 2012 and then I did not attest in 2013, and I'm coming back to meaningful use this year in 2014, I am going to be in stage 2 because they look at the calendar years in terms of those 2 years as opposed to how many years was I successful. So the clock essentially keeps ticking. So when they say that once you start, you can't stop, that's really what they mean. That clock keeps ticking in terms of those years. So let's focus the rest of our discussion around patient engagement specifically, as it's a key focus going forward and a focus that many practices and EPs find very daunting. So stage 2 will significantly change the patient experience and the interactions between providers and patients. So if we take a step back and we look at what did we do in stage 1, and for those of you that are still in stage 1, eligible providers were focused on using technology to inform patients about their care. Very unidirectional, doctor-centric. Tell your patients what they want, what you want them to do. So whether that's providing educational resources, providing them with online access, or preventative care reminders, it's focused on giving information out to patients, but not getting anything in return for patients. The other thing to note is that patient education, online access, and preventative care reminders aren't menu measures in stage 1, so they're completely optional. As we move to stage 2, the rules change. The measures now require patients to become active participants and to take actions. And we move to a more patient-centric approach to engagement. The stage 2 measures require patient-initiated communication. So at least 5% of your patients are going to use secure messaging to send a message from the patient, unsolicited, to the eligible provider. So if you're thinking that you can use the secure messaging to send a message to your patient, that's fine. But for meaningful use, we're expecting your patients to use that secure messaging unsolicited and send a message to your doctor. So you're going to have to encourage patients to start using that functionality. Preventative care reminders also change from the standpoint that not only are they a core measure in stage 2, but you also have to send those reminders based on the patient's communication preference. So the things that we could kind of get away with in stage 1 and under the 2011 criteria, we can't quite do and get away with as we move into 2014 and stage 2. We also require patients to view online, download, or transmit their record. So in other words, we're expecting 10% of our patients to actually go in and look at their record online. So it's not just acceptable to make sure that they have access to the record, but we expect them to go out and actually look at it too. Our educational resources have to be suggested by data that's in the EHR. So I can no longer just simply tell a patient that they should go out and look up their information on WebMD. I'm looking for something specific that's coming out of my EHR and using that functionality. So there's much more emphasis in the measures in Stage 2 to use your certified systems, to use the functionality within your certified systems. And these measures now become core and can't just simply be deferred, like we saw in Stage 1. And it all starts then with provider action. So in Stage 1, most of the providers avoided the patient engagement measures. So if we take a look at the patient engagement measures for the eligible providers and how many physicians actually attested for these menu measures in 2011, 2012, and part of 2013, we see that almost over 80% of all the providers that attested for Stage 1 decided to defer on patient reminders. So they didn't even bother to do that measure. There were obviously other measures that were easier to do, maybe had a much better workflow. So there's a huge percentage of folks that have to, of providers that need to figure out, how am I going to implement this in my workflow as I go into Stage 2? The other one that's very interesting here is the timely electronic access, and that refers to the patient portal. So 66% of all providers that attested for Stage 1 decided not to attest for the patient portal measure. So just simply giving that patient access to their record online, not even going in and using the functionality that's in there. So one of the reasons why there's such a high deferral rate to the patient engagement measures is that typically the workflow is very difficult. So in order to send patient reminders, to send reminders to patients, there was no automated workflow within the EHR. You would have to do that manually and then go back into every patient chart and essentially check a box so that that showed up on the reporting. And part of that was driven by the way that products were certified. So under the 2011 certification program, vendors could certify their EHR to have functionality that might meet the certification criteria. So I can identify a patient that was sent a reminder. But actually trying to use that functionality from a provider standpoint was not very easy. So in the case of the patient portal, knowing that you had to go out and deploy new software, trying to make sure that your patients accepted that portal and to get them to sign up, all of those things that required a lot of activity on the side of the practice, and thus most of those measures were deferred. So as we look to the patient reminders specifically, and as we know, going into Stage 2, I can no longer defer that measure. Some vendors are telling eligible providers that they can use appointment reminders to satisfy the preventative care reminder measure. So knowing that there's typically an automated way and a very simple way to send appointment reminders, many vendors are suggesting this to their practices. And while this was true under the 2011 criteria, you could use appointment reminders to satisfy preventative care reminders. That is no longer an option in 2014 for either Stage 1 or Stage 2. So if you were audited in using appointment reminders, that's not going to satisfy the requirements of the measure and would put you in a bind in terms of an audit. When we look at the actual measure and the CMS FAQs, we see that the measure is asking for you to use clinically relevant information to identify patients who should receive reminders for preventative follow-up care, to send those reminders based on the patient preference, But most importantly, for the measure and for that reminder to count, the reminders have to be for care that the patient is not already scheduled to receive. And that is the key component right there. So what's not an appropriate preventative care reminder? An appointment reminder, so you have an appointment on January 21st, or a recall message, don't forget you need to schedule your checkup. Any other type of reminder for something that is already scheduled. And the reason why recalls fall under there is that from a CMS perspective, they see recalls as something that's essentially a functionality in your practice management system and not necessarily using the functionality that you have in your EMR and the information that you've captured about that patient. So on the other hand, what you want to look at is a reminder for a flu shot, right, for an appropriate patient. A reminder for a gap in care for a patient that's not already scheduled to receive that. Maybe coming in to report the results for a hemoglobin A1C for a diabetic patient. And it's actually a really great opportunity for you to use the measure to drive patient compliance and to build your practice revenue. So you want to think about how can you use the information that you have in your EHR to remind patients about actions or follow-up care that can improve their quality of life or improve their outcomes. So you really want to use your preventative care reminders to engage your patients in between visits. So how, typically practices think about the engagement that they have with patients as being very visit-centric. So the activity that you have with that patient will exist in that small amount of time that you have when you're facing them one-on-one. But the preventative care reminders are really a way to extend your reach to your patients outside of that traditional office visit. And when you can automate the workflow around a preventative care reminder, then it makes that measure and it makes that engagement far easier. So here are a few steps that you should take to not just effectively satisfy the measure, but also to make sure that you're a little more effective in engaging your patients in between visits. So really the first step is to capture the patient's communication preference either in your practice management system or in your EHR. So hopefully your practice management system allows you to enter the patient's communication preference and transfers that information into your EHR, making it much easier for your registration staff to capture that information. So something that your front office staff should be able to capture when they're checking in that patient, as opposed to having your clinical staff have to enter that information. So we know that the measure requires that you send a reminder based on that communication preference. You want to make sure that you're starting to capture that. You also want to make sure that you're delivering those messages across multiple channels. So when you're asking the patient about their communication preference, it's perfectly acceptable to have a list of choices rather than to be completely open-ended and allow them to pick and choose anything that they want. But make sure that you have a reasonable list of choices for your patients to choose from. So voice, text, email, maybe also regular mail and patient portal would be a good selection for your patients to choose from. The second step is to identify what care gaps are important to your practice. So, for example, you may want to identify opportunities to close gaps in care that are specific to the goals and objectives in your own practice. Maybe setting a specific outcome goal that you want to hit with your clinical quality measures or your physician quality reporting system measures if you're using PQRS versus the CQS. And so if you think about those, you can come up with several different options. Campaigns around something like a flu shot reminder provide the quickest wins, where you can target a large group of patients, communicate effectively and easily, and either get the information that you need to update the record or to drive them back to your practice to have that service. You could also set a different goal, such as ensuring medication compliance, right, by using active response, allowing your patients to respond to a question such as, I've picked up my refills, I've taken my medication, if it's something that they don't take on a, maybe they take on a regular basis, but they're not very good at taking. And then, of course, most importantly, automating that message delivery. So I mentioned that we want to communicate based on the patient's preference, but it doesn't mean that we have to communicate based on the patient's preferred language. So the reminders have to be sent using the preferred communication medium, and it's limited to the type of communication. So phone, email, text, and so on does not extend to the actual preferred language or to when that communication needs to be delivered. But keep in mind that what's your overall goal, right? So are you just trying to satisfy the measure, or are you trying to move your patients to action? If you're trying to move your patients to action, then we know that communicating by preferred language is certainly more effective. It's just not required when you're looking at the communication preference for the meaningful use measure. So make sure that you're enabling multiple channels and automating that delivery, and then make a decision based on your practice's makeup as to whether it makes sense to add in additional languages besides English in those communications out to your patients. Along those same lines, I often hear eligible providers saying that they can just simply use their patient portal for preventative care reminders. But this can also be a very big challenge. Portals are great as part of an overall engagement strategy, but they have a very limited number of communication channels from an outbound perspective, and you need to make sure that you're providing those reminders across multiple channels. So it's not going to be acceptable to say all of my patients can be sent to the patient portal and that's going to satisfy my preventative care reminders, when I'm not really providing my patients with a choice in how they want to be communicated with. And typically portals, if they have any outbound communication at all, is typically email and not text or voice or some other means. They typically tend to be static. So from a patient portal perspective, they house wonderful information. They're a tremendous resource, but they typically rely on that patient to log in to get the information that they need. They're not actively driving that patient to take a particular action. So when we think about patient portals and preventative care, you really have two complementary strategies that are at play, one static and one that's active. So as the portal is required for stage 2, you could also use notifications, whether it's text or email or automated voice communications, to help drive your patients to your patient portal, letting patients know what is available and how they would action or how they would access that information in that patient portal. So the two strategies should really be complementary rather than picking one or picking the other. And probably the myth that I've heard the most recently is that specialists are somehow exempt from preventative care reminders. And so the only exclusion that's available for preventative care reminders is for any eligible provider who has not seen any patients, so they have no office visits, in the last 2 years. And probably if you don't have any office visits in the last 2 years, you probably don't have a lot of charges for Medicare and may not be eligible for meaningful use in the first place. Now, the argument that I have typically heard here is that specialists mainly engage in episodic care, so they don't have opportunities to provide preventative care reminders. So in one of the conversations that I have had was with a gastroenterology practice where they asserted that they don't really know what they would remind their patients around because they're engaged in episodic care. But as we started to dig into that and to kind of brainstorm about what patients would make sense, what type of reminder might make sense for those patients, we started to realize that although the majority of their practice is episodic in nature, they also have a group of patients that they treat and manage with chronic diseases, right, like Crohn's disease or Barrett's esophagus. And so we could target those particular patients for follow-up care that would make sense to send a preventative care reminder. But you could also look at some other opportunities here as well. So like our flu shot example that we discussed before, even if you don't perform a flu shot in your office, providing a reminder to patients is just a good service to your patients and shows that you care about their continued care and can help you to drive better CQM scores. So there's certainly opportunities, but you may have to be a little more creative depending on your specialty. So I want to take a look at a couple of different case studies that we've seen using preventative care reminders to engage patients and to drive patient actions. So I'm going to start with two that are fairly simple and easy to deploy and to look at how you might use these in your practice. So more real-world examples, if you will, of the power of patient engagement, driving patients to action, using preventative care reminders. So the first case study that I'm going to look at here comes out of Scottsdale Medical Imagery Group, where they just started on an ongoing campaign to contact patients who were 30 days overdue for routine mammograms. And start from the very first initiative that they had, the first month that they sent out the campaign, they've consistently seen a 20% conversion rate from their annual notifications. So the interesting part to that is that not only are they driving their patients to get the care that they need, but they're also gaining significant additional revenue. So when we look at the revenue that's been driven just around a single campaign, driving your patients to go and get routine mammograms, this particular practice was able to bring in an additional $240,000 in appointment revenue annually, just from simply sending out those reminders and having patients take action to schedule their routine screening. In a second example around preventative screenings, comes from a pilot study from Ochsner Health System in New Orleans, where they decided to look at patients who were overdue for colon cancer screening to see if they could impact two things: their patient compliance through the automated reminders, and then can they also impact their revenue as well. In doing this pilot, they identified over 3,000 patients that were due for colonoscopies or upper endoscopies and contacted those patients over a 1-month period. At the end of that first month, and contacting those 3,000 patients, they had almost 600 patients who scheduled their screening. So driving an 18% conversion rate from patients who were not currently scheduled, and having a significant impact on their bottom line by driving almost $700,000 in revenue. But maybe more importantly, what we see from an example like this is that there's a significant impact on the care for their patients. Right? We know that screening, the colon cancer screening, is critical to early detection and improved survival rates. So both of these first two examples are fairly easy to set up and fairly easy to action. With both of these, in order to set up something along the same lines, you would identify which patients do I want to message around driving them to action a particular screening, we would set up, you can set up a message around that to send out to patients, and then simply send that out through multiple channels, and then see the results that come back in. So fairly easy to identify, and fairly easy to identify those patients within your EMR as well, based on the profile that you're looking for. So in those first two examples, it's fairly direct. So you're going to send a reminder to a patient. You're asking for a specific action to schedule a screening. But I also want you to think about how you can use preventative care reminders to not just satisfy that preventative care reminder, but maybe to support your reporting or clinical quality measures, and also to help you with maintaining a much more robust picture of what your patients are doing in between visits. So I'll take a flu shot example here, where we can ask a series of questions and then solicit responses, specific responses from patients to those questions. And so those questions can get set up either as the example that we have here, or certainly can be tweaked based on the information and the insight that you're looking for specifically for your practice. So in this particular example, we all know that patients have multiple options and places they can go to get a flu shot, whether that's in your practice if you offer them, at the Walgreens down the street, or other locations as well. So in this particular example, we want to first ask the patient if they've received a flu shot. So if I haven't given it in my practice, I don't necessarily know whether my patient has gone and gotten one yet or not. So that's the first question. Have you received that flu shot this year? And allow that patient to answer yes or no. If they have gone and received that flu shot, it allows you then to update the record based on that information, and then that's reportable into your clinical quality measures. If they have not gotten a flu shot, then it gives you the opportunity to encourage them to either go and get a flu shot, whether that's down the street, or to drive them back to your practice, knowing that they can come in and schedule that flu shot, or come in perhaps as a walk-in as well, and provides them then with that information. So very, very powerful to drive not just the patient action, but also to help you to better manage and update their records. And to wrap this up, I want to show you a very different example, a much more complex example of ways that you can use patient engagement that allow you to better monitor your patient's medical conditions. And it also helps the patient to better manage their own care in between visits around a specific disease state, becoming then an active player in their care. In this particular example, the patient is asked a series of questions around their symptoms having to do with COPD. And it's based on an existing COPD action plan that has existed with this health system for some time. The difference with this particular study and with this particular pilot was that outside of just a human intervention with that patient to ask how they're doing, they implemented an automated strategy with an automated call that went out to the patient's home twice a week. By automating the process, then they're able to reach far more patients and to get information back into the system and back into the hands of their care team very quickly and very easily based on the responses from the patient. So it allows your care team then to focus on those patients that really need the follow-up rather than those that are doing very well. So in this particular case, that the patient gets an automated call twice a week. You could also do that through text or through email. It is also an option there. The patients respond to the survey by pressing 1, 2, or 3 based on their current symptoms. then based on those responses, the patient is presented with essentially next steps in that action plan based on those symptoms. So defined in that predefined zone or care plan. So if we look at the green zone, the yellow zone, and the red zone, so based on the patient's symptoms, they're going to be driven to a specific action plan based on which zone they fall into on that particular day with that particular response. That information then, that data is collected from those response patients that are most at risk and that need follow-up action. So providing that practice then with much better opportunities to manage that patient's care, and in this case, from the results of the study, lowered the readmission rates and lowered the overall admission rates for COPD. So in closing, patient engagement is just simply good business outside of satisfying the measures and the measure for meaningful use. So whether you're using automated reminders for preventative care, patient monitoring, or alerting your patients to available resources such as your patient portal, automated notifications allow eligible providers and practices between visits. And you empower your patients then to make better decisions, to become better active, more active in their care, and to improve their care overall. And so with that, I will open